Hello, my name is Tyler Surber, and I will be giving a presentation on the transmissions of contagions. So, the dictionary.com defines a contagion as the communication of a disease by direct or indirect contact. And contagions can come in many different styles. You have one direction where you could take that has viruses, bacteria, prions, parasites, funguses. On the other hand, you have transmission through water or air, blood, or contact. The scariest realization is that anything can be transmitted through any point in time due to airplanes, trains, and vehicular transport. So first I'm going to go over transmission through air. And I'm going to use the example of Bordetella pertussis, which is the scientific name for whooping cough. Pertussis is a bacterium that attaches to the cilia of the upper respiratory system and causes the bronchial tubes to swell. It is extremely fatal to infants and is contagious up to 2 weeks after symptoms have subsided. There is no effective vaccine that works 100% according to the CDC. Aspergillus is a type of mold. It's a common mold that's found everywhere, whether it be indoors or outdoors. While it is not the most common mold in the world, it has the highest number of mycotic infections, and it'd be pretty safe to assume that everybody's breathed in some of these spores at one point in time or another. So, according to the paper Aspergillus fumigatus and Aspergillosis by Jean-Paul Latgy, it is estimated that infectious aspergillus occurs in 10 to 25% of all leukemia patients, in whom the mortality rate is 80 to 90%, even when treated. Infectious aspergillus is now a major cause of death at the leukemia treatment centers and bone marrow transplantation and solid organ transplantation units. And according to the CDC, there's around 180 different species of aspergillus, but only 40 are actually known to cause infections inside of humans. It normally prefers to grow inside of soil or on top of organic debris. Once the body becomes infected, it can spread throughout the rest of the body from the lungs. Some of the signs of infection are wheezing, shortness of breath, coughing, sometimes until blood, congestion, runny nose, headache, fatigue. It all depends where the spores get stuck and lodge and start growing. Next, I'll cover water. Cholera is a waterborne bacterium that causes vicious diarrhea that usually resembles cloudy rice water. It can be fatal within hours due to dehydration and loss of salt. It's usually contracted by ingesting food, especially shellfish, if it is not cooked properly, or water that has not been properly treated. According to the World Health Organization, 80% of people infected do not develop symptoms, although they are still potentially infecting more people for 1 to 10 days after they become infected. Cryptosporidium is a parasite that causes cryptosporidosis. After the initial infection, the parasite burrows into the small intestines, and from there it releases its eggs into the fecal matter, which is then flushed down the toilet, and it enters the water treatment facility, where it's usually very difficult to clear out. According to the CDC, the parasite is protected by an outer shell that allows it to survive inside of the body for long periods of time and makes it very tolerant to chlorine disinfection. Cryptosporidium is a leading cause of waterborne disease among humans in the United States. While a person with a good immune system it will still cause them extreme discomfort, it's a lot more fatal to people that are immunocompromised or taking immunosuppressive drugs. According to the Mayo Clinic, a person can become infected with crypto from drinking contaminated water, swimming in contaminated water and accidentally drinking a little bit of it, eating uncooked contaminated food, or touching hand to the mouth after the hand has come in contact with a contaminated surface, or being in close contact with infected people or animals, and especially their feces. According to the CDC, symptoms generally begin about 2 to 10 days after infection, though it's usually an average about 7. The symptoms are usually present for 1 to 2 weeks, but can come and go for up to a month. Toxoplasmosis gondii is another parasite that normally runs through felines into mice. A large percent of the world has already been infected with it, but most people don't realize it because the only reaction that it has is it slows their reaction time just a little bit. And it's not normally significant enough to notice a difference. So, according to the CDC, it can be contracted through eating undercooked or contaminated meat, especially pork, lamb, or venison, using contaminated utensils that have had contact with raw contaminated meat, or drinking contaminated water, or through accidentally ingesting contaminated soil while gardening or cleaning an infected cat's litter box. This is why pregnant women are not supposed to clean out a cat's litter. If a pregnant female does, it can cause, according to the Mayo Clinic, seizures, jaundice, severe eye infections, hearing loss, and mental disabilities, but they may not appear until the child's teenage years. It can also be contracted through receiving an infected organ transplant or blood transfusion. So necrotizing fasciitis is a bacterium that is rare but deadly if it's not treated quickly. It enters through an open wound, and it can cause severe pain, fever, chills, and fatigue or vomiting. The skin starts to be eaten away, and it turns black, or gets pustules or blisters on the skin. And after the skin starts to dissipate, it is really difficult to treat. And the CDC states that this is why rapid surgical exploration and removal of dead tissue in addition to antibiotics is often critical to stopping the infection. Prions, so Creutzfeldt-Jakob's disease, also known as human spongiform encephalopathy or mad cow's disease, which is bovine spongiform encephalopathy. Prions themselves, which is the cell disease, the CDC refers to prions as an abnormal pathogenic agents that are transmissible and are able to induce abnormal folding and specific normal cellular proteins, and the abnormal folding of the prion proteins leads to brain damage and characteristic signs and symptoms of the disease. Spongiform encephalopathy is extremely fatal neurodegenerative disease that causes symptoms similar to Alzheimer's and dementia, though the onset usually tends to be faster. Classic Creutzfeldt-Jakob's disease tends to affect the older population, most dying a year after they start showing symptoms. Bovine spongiform encephalopathy may have started through a crossed infection by serving scrapie infected sheep meat and bone marrow to adolescent cows as meal. This leads to the thought that leads to a new variant of Creutzfeldt-Jakob's disease, which tends to hit a younger population, though the extended younger population, and it was most likely created by an extended exposure of the population of potentially contaminated bovine spongiform encephalopathy food. It's particularly scary because it can be infected through the consumption of food. The fourth variation occurs primarily in Japan, according to the National Institute of Neurological Disorders and Stroke. It is a panencephalopathic form that usually takes multiple years for the symptoms to progress. According to WHO, sporadic Creutzfeldt-Jakob disease count for about 85% of the reported cases, and there's no real known reason for it. And then there's familial form of contraction, which is usually through the genetic code, like passed down from the parent to the offspring. And then you have iatrogenic Creutzfeldt-Jakob's disease, which is accidental transmission through using contaminated surgical equipment or due to corneal or meningeal transplant or infected blood transfusions, or through dura mater. According to the public health impact of prion diseases by Belay and Schoninger, other distinguishing characteristics of prions include the resistance to inactivation by proteolytic enzymes and conventional disinfectants and standard sterilization methods. Everybody can spread disease, whether it be through airplanes, trains, automobiles, boats, pools, drinking waters, food, surfaces, blood contact, sand, soil, and even the air that surrounds us. They're all filled with deadly contagions that can easily spread from one person to another. A way to prevent this is by washing hands with uncontaminated water or using an alcohol-based cleaning gel. And if you are, especially after you come in contact with fecal matter, in underdeveloped countries, rubbing your hands with sand or ash and then rinsing with uncontaminated water is about the best that they can get. Water can usually be purified by boiling or adding chlorine tablets to the water, though this won't kill everything like cryptosporidium. Make sure that food is cooked to the proper temperature and avoid large groups of people during an outbreak so that you may live to see another day.